coworker has fallen about 30 feet from a scaffold onto a dirt floor of a large open air pit. You respond with the ERT. As you approach, you find him laying on his back with obvious deformity to the right arm and blood on his pants at the right femur. He is not moving or moaning. It appears that his chest is rising and falling.
Okay. I have my PPE on. The scene is safe. It looks like I have one patient. My MOI is a fall. I'm gonna go ahead and call for ALS, and I'm gonna have my partner hold C-spine. Hey, are you okay? Can you hear me? Does he respond?
No.
Okay. Does he respond to painful stimulus? I'm gonna pinch his shoulder.
No.
Okay, then I'm gonna check a carotid pulse. Does he have a carotid pulse?
It doesn't say.
We'll assume he does.
Sure.
Otherwise, this is just CPR. Okay. So he has a pulse. He is U on the AFQ scale because he's unresponsive. He did not respond to pain. My general impression is very poor, and his chief complaint is that he is unresponsive. So I'm gonna move into the ABCs. I'm gonna check his airway. Do I see anything in his airway?
Patient is snoring and gurgling red tinged frothy sputum.
Okay, I'm gonna suction the airway. Is the airway clear now?
Yes.
Okay, and I'm gonna go ahead and check his respiratory rate.
Which is,
While I'm checking that, I'm gonna go ahead and put in an oropharyngeal airway to keep his airway open since he's unresponsive. Does he accept the OPA? We'll assume yes.
yes.
And did I get a respiratory rate?
Sorry, it's like 3 different pictures. Respiratory rate is 14.
Okay, respiratory rate of 14. So I'm gonna go ahead and apply high flow oxygen. I'm gonna have my partner use a BVM, so we'll do 15 liters per minute with a BVM. And that's my airway breathing. I'm gonna move to circulation. Do I see any major bleeding anywhere?
None obvious.
Okay, no obvious bleeding. What is his skin condition?
Cool, clammy, and pale.
Okay, and what is his actual pulse rate when I check it?
100.
Okay, I'm gonna go ahead and cover him with a blanket to treat him for shock and keep him warm. And I would like to transport this patient as rapidly as possible, but I have to get through my head to toe assessment first. So I'm going to, while I'm doing the assessment, I'm gonna have my partner get a full set of vitals, including blood pressure, and I'm gonna have them also get a sample history. So I'm starting with the head, checking behind the ears. Just stop me if I find anything. Checking the ears, pushing on the forehead.
There's bleeding coming from the right ear.
From the right ear? Okay, I'll just apply a gauze to control the bleeding. Do I see any cerebrospinal fluid in there?
No.
Okay, I'm gonna push on the forehead, open the eyes, check the pupils, push on the nose.
Pupils are unequal, the right is sluggish.
Okay, sign of a head injury, I'll take note of that. I'm gonna look in the mouth and see if I see anything else. Checking the back of the cervical spine, checking for JVD and tracheal deviation. And I'm gonna go ahead and have my partner put a C-collar on. I'm gonna check the clavicles. I'm gonna come down the chest.
Diminished,
And I'm gonna palpate the ribs. And now I'm gonna auscultate the breath sounds.
Diminished sounds and paradoxical movement on the right side, labored breathing.
Okay, sounds like we might have a flail chest. There's nothing I can really do to that. I'll look at, expose it, make sure there's no open wounds. Assuming there's no open wound, I'll just take note of it. We go through the abdomen, palpate all 4 quadrants. Okay. Moving down to the pelvis, I'm gonna squeeze in and now down. And I'm also going to consider checking genitalia. Do I see a need to check that?
No.
Okay, and I'm gonna come down. I think there was an obvious deformity to the femur here.
Laceration and bruising at right femur.
Okay, I'm gonna have my partner apply direct pressure. Does that bleeding stop?
Yes.
Okay, I'm gonna continue down the leg, check pulse on the foot, check the other leg, come down, check pulse on the foot. Okay, and we didn't have any injury to the pelvis or leg other than the femur, so I'll have my partner apply a traction splint to that leg. I'm gonna come down the other arm, the right arm, just checking pulse.
Obvious deformity at the right arm at the elbow.
Okay, I'm gonna look at it. Do I see any bleeding?
No.
Okay, I'll have my partner apply splints. I'm gonna check the other arm, checking the pulse at the end of the arm. And have my partner help me log roll the patient on 3. 1, 2, 3. We'll log roll, we'll check the whole back. Going down the spine, also doing a blood sweep. Didn't find anything. We're gonna log roll onto a backboard on 3. 1, 2, 3. Now we're in the ambulance. We'll transport our patient while we check our vitals every 5 minutes. That's the end.